Medurstand. Understanding medicine.
Professor Aziz Rehman from Medurstand, and now we're going to elicit the signs of cerebellar disease. Cerebellar disease is also fairly common condition, and it could be congenital, genetic, degenerative, or it could be a result of CVA. Now in CVA obviously it would be one-sided, but in cases of genetic or degenerative it is usually bilateral. So there are some signs which can tell you if somebody has cerebellar disease. First of all is the gait of the patient, that we'll do in another video. So when the patient is moving towards, you can tell that this patient has got cerebellar disease. Patient has got ataxia. Patient cannot move straight in a balanced position. That is one thing, and the other thing is when you're talking to the patient, patient has a typical speech, and that can also tell you or give you some idea that patient has got cerebellar disease. Then there are 2 or 3 tests which I am going to demonstrate which we should do. उठ के बैठे जरा, उधर को आ जाए. अच्छा, ये आपने अपनी उंगली पेरी उंगली को लगानी, फिर अपने नाक को लगानी, ऐसे ऐसे बार बार. ठीक है, मैं अपनी उंगली हिलाऊंगा मुख्तलिफ जगहों पे, आपने बिल्कुल एक्यूरेटली लगानी इस साइड से. ठीक है ना, फिर दूसरी साइड से करनी, ठीक इसी तरह करके नाक को लगानी. चलिए अब ये करें. अब इसको लगा के अपने नाक को लगाएं, बिल्कुल ठीक. अब लगाएं. So you have to keep moving your finger so that patient can only do it if his cerebellar system is intact. अब करें. So he can do it pretty well. Then maybe I can ask him to bring his 2 fingers like this and close to each other. And I think if you ask him to bring it to at least 1 inch distance, that requires more coordination. We actually testing coordination because coordination is the function of cerebellum. So ऐसे करके ना अपने उंगलियां दूर से लाके अपने पास 1 इंच के पास रोकनी है. So absolutely fine, he can do it without any difficulty. So this is another sign that the coordination is okay. एक और करेंगे. आपने ना, मैं इसको ज़ोर से दबाऊंगा, आपने इसको ऊपर नहीं जाने देना. ठीक है. So like this. If it moves all the way up, that would be another sign of cerebellar disease. One feature of cerebellar disease is dysdiadochokinesia, and normal person should be able to move this movement repetitively and without any problem, like this one. करें जरा, करते जाओ. I think I usually use this method. I ask him to make a roti, ऐसे बार बार करें. And normal person can do it without any difficulty. If somebody has difficulty doing it, then you have this indication that there is a cerebellar disease, dysdiadochokinesia. Now we are going to test for any involuntary movements, and involuntary movements, the most important is tremor. One is fine tremor. I think you just hold the hand like this and look at his fingers. Normally they should be stable, but if they have fine movements like this, that would be called tremor. So there is no tremor at all, and there are various types of tremors. One is intention tremor. Intention tremor is precipitated by intention to approach something. Like for example, आप इधर से लाके मेरी उंगली को टच करें. Okay, so there is no tremor. If there is a tremor, that increases on when somebody is intending to point something, that is a sign of cerebellar disease. And if we elicit tone, there may be hypotonia in cerebellar disease. Cerebellar disease may be little difficult to diagnose clinically. So I think that was all about the cerebellar disease. Thank you.